Hi everyone, I am Dr. Sagar Sahu and welcome to Veterinary. So today I welcome you to 6th lecture in the series Orthopedics. From today we will be starting the fracture fixation system, under which we will be studying the external coaptation bandaging, then we will study the external fixators, then we will study the intramedullary pinning and wearing, and lastly the plate and screw method. Okay, all those things we will be studying under fracture fixation system. This will be the first lecture under fracture fixation system, but the broad topic is orthopedics. This is the 6th lecture. Before this I have already covered 5 lectures. I will give the link in the description. Do watch them. Okay, so today we will be studying the external coaptation bandaging. Before going to the lecture, some formalities, you know this one. Okay, so if you are enjoying my content, do subscribe to the channel, and if you are new, definitely subscribe to the channel. Apart from that, do follow me in Facebook. I post different cases pictorially. Important one is actually the Instagram. Here I post all the notes, okay, and the updates regarding the videos. Okay, now this is the book which I am currently following for the preparation of these lectures. It is a small animal surgery by Theresa Wilson. And don't worry, I will give the link of this book in the description if you want to study further, and also I will give the link of this particular class note and also the PPTs that I am using in PDF format in the description. We'll give a drive link. Okay, so don't worry, no need to take any notes during the class. Notes will be available, simply listen to the class. So first of all, we should know that what are the forces that acts on a bone before going to the fracture fixation system. There are torsion forces, tension forces. Just see the direction of forces. The arrows represent the direction of forces. First one is the tension forces. Okay, suppose this, if you will see these fracture sites, suppose these are fracture sites. So here it is away from fracture sites. Okay, tension forces, compression forces towards the fracture site, bending forces. Okay, like this, it will be bending forces. This is shear forces on opposite direction. Okay, horizontal forces but opposite direction. These are kind of vertical forces. Horizontal forces but in opposite direction. This shear force, and the torsion is basically spiral like this. Okay, torsion forces. Most of the spiral fractures are because of torsion forces. So these are the forces that act on the bone, and we will be studying different fracture systems. Take a screenshot of this particular table. Okay, it depicts the strength of all these fixation systems and their strength against the bending, rotation, compression, tension, and shear process, all those things. Okay, we will start the, when we will be discussing individual, we will also discuss the forces. Okay, so first one, let us come to our lecture, that is the external coaptation bandaging. What are the objectives of external coaptation bandaging? First of all, it is very much applicable, or it is so adequate, or you can say it is appropriate to use to stabilize, or you can say that to support the fractures below the elbow on the cranial or the forelimb, and in the hind limb below the stifle. Okay, above that it does not provide any support, and it is kind of contraindicated if there is humerus fracture or femur fracture. If you are doing external coaptation bandaging, then it may further deteriorate the condition. Okay, so it is below the elbow and a stifle. It is done to give some comfort to the patient. When you will be doing the external coaptation bandaging, what it will do? It will simply reduce the movement between the fragments, the fracture fragments. The movement will be restricted. When the movement will be restricted, the nearby nerves will be less compressed or less injured by these moving segments, or sometimes there may be sharp segments which may prick. Okay, so this particular bandaging technique provides patient comfort, especially before the surgery. Decreasing the soft tissue swelling. You know, when the movement will be reduced, definitely the swelling will reduce. It is very much helpful for if the patient is going for surgery, and if you are doing external compression before the surgery, then it will help to reduce the soft tissue swelling, so that you can better visualize the segments, the fracture segments. Then you can do your work. And it can be applied, usually it is not a primary repair method for fractures, but it can be a primary repair method or primary fixation method for the patients which has fracture assessment score 8 to 10. I have discussed vividly regarding the fracture assessment score in previous videos. In the link, in the description link, I will give the link to the playlist. Among the playlists, do check the fracture assessment score. Okay, higher the score, lower is the risk. Okay, so among 8 to 10, suppose there is a young patient, it is a good method. It neutralizes the bending and rotational forces, but it is very much susceptible to compression forces. Okay. Next, first one is the Robert Jones bandaging. Okay, we will see some techniques. First one, Robert Jones bandaging. What are the steps in the Robert Jones bandaging? We will see the image also, don't worry. So first of all, suppose this is the limb. So this is the dog and this is the limb. Okay, this is the limb. Red color is the first one. You have to clip the hair. Okay, from mid humerus in the anterior limb or the forelimb, and from mid femur in case of hind limb to toes. Okay, you have to say from the humerus or mid humerus or mid femur to up to the toe. Treat any open wound. If there is some open wound, first do the dressing of those open wounds. You clean the area, then irrigated with antiseptics, then you apply some antiseptic ointments, apply a gauze. These are basically dressing. Treat any open wound. Next, you have to apply adhesive tape stirrups. What is adhesive tape stirrups? There are some adhesive tape stirrups like in the brand name like Leukoplast, Flemiplast, all those brand names. Adhesive tape stirrups, those are coming. So what is the principle of applying these adhesive tape stirrups? You have to apply cranial and caudal surface, and it should be applied from the carpus or torsus in case of hind limb to 15 cm beyond the toes. So how we will apply? Suppose here is the limit of the carpus. Okay, suppose this is the anterior forelimb. So you have to apply these tape stirrups like this. Okay, cranial and the caudal you should extend 15 cm beyond the toes. Avoid circumferential tapes. These are cranial and caudal. Circumferential like this. Okay, circumferential tapes. Sometimes it may block some blood vessels, or there might be some swelling caudal to the or distal to the circumferential tape. So avoid these circumferential tapes. Next is the cotton padding. Next, you have to apply the cotton padding, or simply it is sometimes known as cast cotton padding. Orthopedic cast cotton is also available in different websites. In Amazon also it is available. So this cotton padding, in Robert Jones bandaging, earlier one, you have to give very thick, like 15-20 cm of cotton. Okay, but in modified it uses comparatively less cotton. So the thickness should be 7.5 cm to 15 cm depending on the breed and the size of the dog. So next layer is the cotton padding. Next layer is the cotton padding. It is actually very thick. This is cotton padding. While doing the cotton padding, remember you should leave the third and fourth toe. Okay, the third and fourth nails. Usually nails should be visible. Okay, don't hide them, because they will be an indicator for any problem with that limb. Suppose cast it too tight, the nails will spread apart, simply limb will swell enough. From that you can evaluate the post-operative complications by these bandaging techniques. All those bandaging, whether the Robert Jones bandaging, next we will be studying some cast, then splints, all those things. For this you need some indications, so that you can appreciate, or you can say evaluate, correct word is evaluate these bandagings. So you have to leave third and fourth toe. Suppose this is third and fourth toe, or the nails, particularly these nails should be outside the bandage. Next you have to apply the elastic gauze, simply gauze bandage. Okay, gauze bandage. It is given to compress this cotton. Okay, to compress this particular cotton, you have to apply. Next layer is the elastic gauze, or simply you can say that gauze bandage. Next is the gauze bandage. The technical term, or in book it is written, it should be after applying this elastic gauze, it is applied in 2 to 3 layers. Okay, it should be so firm, it should feel like a watermelon. After applying, when you will tap this surface, after applying, it should feel like a watermelon. It should be slightly firm. Next layer is the elastic tape. In brand name, or you can say that it comes with like Vetrap. Most common one is a Vetrap. It's a very good tape. Okay, I earlier didn't know about this one, but after reading, not now, a few years back when I know, and I ordered from Amazon and used it, is excellent. Okay, though little bit of costly, but it is excellent. So then you have to apply elastic tape. We will see some images also, don't worry. So after that you have to apply the elastic tape. Okay, next is the elastic tape. Now it is complete. After apply 2 to 3 layers, you can use 2 layers is maybe sufficient many times. So after applying the bed wraps, so what you have to do, you have the stirrups outside. This is the stirrups that is coming out, or it is beyond the toe. Now simply invert it. You have to invert it and paste it towards the outer bed wrap. Okay, bed wrap like this. What will happen? It will prevent slipping of these cotton padding, and you have given elastic gauze or gauze bandage. It will prevent slippage of these particular bandages. Okay, so these are the steps in modified Robert Jones bandaging. In plain Robert Jones, it is kind of more thicker. Simply as simple as that. Next, see some images. Here these are images. Here you see the wound has been treated. Hair has been. First one is the hair is clipped. Here the hair is clipped. Here you can see there is hair in other limb. Here no hair. Hair has been clipped. Next, the open wound has been treated. Okay. Second step is open wound. It has been treated. Third, you can see here the tapes are applied. Okay. Elastic tapes or adhesive tapes. Okay. This is stirrup. Here you can see here it is a stirrup. Okay. So this is cranial surface. There will be another tape in the caudal surface. After that you have to apply the cotton. You can see here this is fourth step. The cotton has been applied. See how thick it is. Okay, the animal is also slightly heavy, so you have to go for thicker side like 10 cm, 15 cm. So the cotton has been applied. Next you can see that gauze bandage is being applied. Fifth step, the gauze bandage is being applied. Okay. Next you see this is bed wrap. Okay, bed wrap is applied. This is the sixth step. After that the stirrups will be attached. Okay, so this is basically the modified Robert Jones bandaging. Next we will study the splints, commonly known as spoon splints. The splints, here the procedure is nearly same. There are few variations. I told you clip the hair. Next treat an open wound just like the previous one. Next adhesive tape stirrup just like the modified Robert Jones bandaging. Next here the cotton padding, it's not like thickened like the modified Robert Jones. Here the cotton padding, the main purpose of this cotton padding is it should be enough to prevent abrasions, especially caused by the splint when you will be applying some splint. Okay, and also it should be have some extra padding, give some extra padding over bony prominences, because you know that when it will be animal will be moving, or there will be much more compression to this. Compression is more at the areas of bony prominences. Okay, so it will cause some cast sore or splint sore. Okay, those can develop. So to prevent that, you have to do some extra padding over the bony prominences. Next, simple elastic gauze. I told you like the previous one. Compression of cotton, then elastic tape application like bed wrap, then simply invert the stirrup and stick it over. Let us see some images. This is the image. Here you can see the cotton padding is kindly of thin, comparatively more thin. Now, in modified Robert Jones, it is very thick. Only 2 to 3 layers is sufficient. 2 to 3 layers is sufficient for padding. Okay. Here the elastic gauze. Then after here is splint is used. See the splint can be made up of different materials. So here it is used a stainless steel. Apart from that, in Desi methods or like in Indian methods also, you will find use of different products. Okay, some use the PVC pipe. Okay, PVC pipe can be used. The advantage of this PVC pipe, what is that you have to cut and make it appropriate length. After that, you can use heat to mold it. Suppose you want a bend here. Okay, simply what you will do, this is the straight PVC pipe, you will apply heat to this section and you can simply mold it. Okay, so PVC pipe can be used, and in some practices they use bamboo also, bamboo splints. They also can be used, bamboo splints. Just like large animals, in small animals also bamboo splints can be used. Okay, all those things, many things also, some iron rods can be used. If at all you are not finding appropriate material, then iron rods in some areas it can be used. Okay, so all those things can be used. After that, apply the bed wrap. Here the bed wrap is applied, then simply invert the tape stirrups and attach it to the outer layer of the bed wrap. Okay, this is spoon split. Next is cast. Cast can be two types. Most commonly it is two types: POP, plaster of Paris cast, and the fiberglass. Use of POP cast in case of pet animal is not that advisable, okay, and it is not that commonly used also. But more common is the fiberglass, although it is slightly costly, but it is way better than the POP. Okay, in POP also we need some warm water, the setting time is also higher, but fiberglass you need some cold water and the setting time is very less. It dries up very fast. Also between the layers of POP, first layer, second layer, the adhesion is comparatively less, while the in case of fiberglass this adhesion between the layers is very good. Also the fiberglass you will need less layering. Okay, in 2 to 3 layers maximum it will set up and it will give good strength, excellent strength. But it is not possible in case of POP. In POP we may need 3 to 4 layers, and also strength is compared to less to the fiberglass. Okay, so in many way fiberglass is superior to the POP. Only thing is that during removal for POP you can use some iron saw or like that thing, plaster cutter also, but for fiberglass you need some oscillating saw. Okay, so with greater power comes some disadvantage, greater side effect. Okay, so it is very good, but only the removal is kind of, you can say, you need some special instruments. So let us come to our lecture. So the principles of fiberglass, mostly we will be talking the fiberglass. Principles of fiberglass application, just like the Robert Jones bandaging and splint, it is applied below the elbow in case of the anterior limb or forelimb, and for posterior hind limb it is below the stipend. Cast should not be applied for humerus fracture or the femur fracture. It can destabilize them. So the principle is joint and joint below should be immobilized. You know this one. Now while the applying, hold the leg in slightly varus. Varus means towards slightly lateral side. If it is in right lateral ligament and you are doing the left limb, simply slightly lift the left limb. And in some flexion, slight degree of flexion, it should be strictly extended. Avoid excessive padding, because when what happens, you see, suppose this is the limb. Oh, this is the limb. So this is the limb. What will happen if you are doing a thick padding? Let me use some different color. Suppose, let me draw a comparison. Okay, suppose you have given a thick padding. You have given a thick padding. Cotton padding, you have given a thick padding. Thick padding. Next we will do the cast application. Okay, this is cast application. What will happen after a few days? This particular padding, cotton padding, will get compressed. What will happen when the cotton pad will be get compressed? It will become like this. Okay, it will be thinner, comparatively thinner. So when it will be thinner, this particular cast will be loosen. Cast will loosen. Here will be the cast, there will be a gap, and it will be loose. When it will be loose, there is might be chance it may come out, or if at all it does not come out, then also it is not an effective cast application. So for that particular reason, avoid excessive padding. Now extend the cast distal to compress the toes. You see, whenever there is fracture below the elbow or stipend, it is good practice that you should do a full cast limb, whether the metacarpal or the radius ulna or metatarsal or tibia fibula. Okay, for all those things you should do a full limb cast. It's a good practice. Okay, so when you will be doing a full limb cast, extend the cast distally to compress the toes, but the middle toenail should be exposed to simply for evaluation, post-operative evaluation. Okay, so this middle toes, it should be outside or it should be visible to the eye. And regarding all those things, I am explaining that it should be full limb cast, whether the modified Robertson bandage or it is the splint, all those are full limb. Okay, it is good practice, because what happens when you will do full limb, suppose you have done a full limb, so when the animal will put some pressure on this particular limb, the load sharing by the limb and the cast will be, bearing more weight, or you can say the bandage or whatever, it will bear more weight compared to the limb. Okay, it is good. If the limb is taking the load, then it will be very much susceptible to compression process, I told you, and it may result in some pain, or it may also result in delayed union, and also it may result in patient discomfort. Okay, so for those there is also a research, okay, in some university I am forgetting. So what they did, in the research they told that suppose this is radius ulna, this is radius ulna, then the carpus, here carpus, then the metacarpus. So what actually they did, if there is a fracture of metacarpus and they did a full limb cast, what happened, this particular area they put some pressure sensors, that how much pressure is actually on the limb, this particular portion. So when they did one appropriate length joint above and joint below, one day they did the full limb cast. So it was seen that when there is a full limb cast, the pressure on this particular bone segment was less. Okay, cast, on the cast it was more, which is a good thing. Okay, if you are doing simply just above and just below, there may be equal loading of this pressure on both cast and the limb. Okay, which is not though good, but comparative to the full cast it is not good. Okay, there should be minimum to minimum force on this particular bone, fractured bone. Okay, so this is compression of the toes, and usually go for the full limb cast. Next, what are the steps in cast application? It is kind of similar, simply some variations. First one, clip the hair, definitely mid-humerus to mid-femur to toes. Treat any open wound. For a fiberglass cast application, if there is some wound, first managed with the rubber splint, rubber joint splint, or rubber joint bandage or splint bandaging. Okay, then when it heals, then apply the cast. Otherwise, you can go for bivalve cast. We will discuss what is bivalve. It is simply variation of fiberglass or cast as a whole. So you have to manage with rubber joint splint or rubber joint bandage or splint, or you can go for bivalve cast. Then attach the adhesive stitches when you are sure that fiberglass should be used. Told you, cranial and caudal surface. Okay, from carpus and tarsal to 15 cm beyond toes. Avoid circumferential tapes, it might result in some edema. Next, you have to apply cast stockinette. It is available in also Amazon, simply in the form of stockinette. You know, ladies, they use this one. This also can be used for the animals. Okay, apply the cast stockinette, and the principle is, it should be, suppose you are doing the full limb cast, so you have in your mind imagined up to which the cast is given, then beyond 5 cm proximal and distal to that imagined level, you have to apply the stockinette. Okay, cast stockinette. After that, you have to apply cast padding, simply cast cotton padding. It should be in 2 layers, it should be more layers. I told you, when it will be in slightly thicker, there will be compression and cast will get loose. So it should be in 2 layers, and it is simply to prevent cast sores. Next, slightly stretch the stockinette. Okay, whatever the stockinette you have applied, slightly stretch with the help of an assistant, so that what will happen, it will prevent folds and wrinkles when you will be applying the fiberglass cast. Cast application. Next, you have to apply the cast, the mostly fiberglass, simply dip in water, then squeeze it to remove excess waters, then simply apply. While applying the fiberglass, do wear gloves. Okay, apply firm pressure over larger muscles, especially in hind limbs, when we using the over the rectus muscles and the triceps femoris muscles. So in those areas, slightly apply more pressure, firm pressure over large muscles, and confirm the cast with the limb. Okay, whatever the limb confirmation there, currently make the cast. I told you also, it should be in slightly flexed, so that you can mold this one. When it will be molded, it will not come out, even if it loosens slightly. Okay, cast application, it should be applied over 50% overlap. Most of the bandages, cotton bandages, gauze bandages, it should be in 50% overlap. Okay, in 2 layers you have to give. For less than 30 kg, 2 layers is sufficient. If it is more than 30 kg, 3 layers is sufficient. 3 layers means it will be 6 layers. Okay, this is the limb, and you applied here 3 layers, then the caudal also have 3 layers. If you will do the circumferential, this is the bone or the skin, the limb, then it will be like this one, 3 layers. It will be in cross sectional, it will be 6 layers. Okay, so 2 layers for less than 30 kg, 3 layers for more than 30 kg. Next, after the cast application, when it hardens, then apply the elastic tape, that is the wet wrap, and they stick the stirrups over the wet wrap. It will prevent sliding. Okay, let us see some images there. Okay, here you can see, okay, cotton padding is kind of little thin compared to the rubber zones and also the spoon splints. You can see here the stirrups is applied. This is stockinette. Okay, this is stockinette. After that, here you can see the application of fiberglass. While using fiberglass, always wear gloves. Okay. Next, the bivalve cast. I told you what is bivalve cast. What happens? Sometimes you may need a stronger cast. Okay, comparative to the spoon splint or Robert Jones bandage. So what you can do? You can modify this particular fiberglass cast. What happens? You have to simply increase the amount of cotton padding. This is the limb. This is the limb. So you have to apply a thicker cotton padding, slightly thicker cotton padding. Then a layer of gauze. After that, why thicker I will tell you. Apply the fiberglass. Okay, this will be the fiberglass. Similarly, here will be the fiberglass. So what you have to do when it hardens? Suppose you have done day 1, on day 2 it will harden, or if you will wait some time it will get hardened. After getting hardened, cut the medial and lateral side of the cast. Okay, if this is circumferential view, okay, and here is the fiberglass is applied, simply cut in medial and lateral. What will happen? It will become 2 halves. Okay, so when it is 2 halves, it is known as a bivalve cast. Simply a technical term. Okay, many times it is also called half cast. Okay, bivalve cast, 2 casts. So these 2 casts has a comparatively more or better strength than splints. Okay, so you use this particular cast. Okay, if you are doing some suppose there is an extensive wound and you require regular dressing and also you require some strength for bone healing, you can use this particular one. Okay, simply remove this cast, or it is attached to through tapes. Okay, so simply cut the tapes, remove this one, do the dressing, again apply with tapes. Okay, and regarding, I told you there should be slightly thicker, because when you will be doing the cutting this particular cast, it protects. Okay, protects to the skin. Although there oscillating saw is sensitive to skin, but still it will protect the skin. That is why thicker padding compared to the normal cast one. So this is basically the bivalve cast. Next one is the Thomas splint. I will not teach Thomas splint in this particular cast because I have made a practical video on Thomas splint, especially for dog and cat, small animals. I have discussed vividly the steps involved, how it is done, how it is helpful. It is mostly helpful for tibial fractures. Okay, for radiosomnia full limb cast is sufficient, but mostly for tibial fractures you can use this Thomas splint, and I have also shared some healing photographs also. So I will give the link of those particular lecture in the description. That was actually a case report. Okay, case report of different cases, 2-3 cases I have built. Okay, many of them the post-operative images are not obtained. Owner may not come after a healing. Owner may owner may stay at home. It will not come for follow up. So those cases which has come for follow up, I have aggregated and presented in the formal case report regarding this Thomas splint. Thomas splint is not in this particular book. Okay, in the book only the modified Robert Jones bandaging, spoon splint and the fiberglass cast. This much is there. Okay, but Thomas splint can also be used. Okay, so I will give the link in the description to check them below. And with this we finish this particular lecture, that is the external coaptation bandaging. In the next class we will be studying the external fixator. Okay, all those things, the linear external fixator, the circular and the hybrid one, all those things we will be studying. Okay, so till then, tata, bye bye, take care.